Good afternoon. I'm Alex Texan, and we are here today for my project defense. Before I start, I would like to thank Dr. Reyes, who's been working with me from day one. It's been a rocky road, but here we are now. I also would like to thank Dr. Barines and Dr. Mueller, who has given me a third person's point of view from different experts in the field. The title of my project is Nurse Mentorship Program Implementation. Nurses are the backbone of healthcare. It is more evident now as hospitals are at full capacity. However, the strain on nurses are causing them to leave, worsening the nursing shortage. Historically, hospitals prefer hiring experienced nurses, but they're rare these days. So now hospitals are recruiting new nurses to work in med-surg units and in-house experienced med-surg nurses for the critical care and emergency department. They're all getting trained through preceptorship programs and nurse residencies. Unfortunately, nurse satisfaction is low after training. This DNP project will investigate if a mentorship program can increase nurse satisfaction, which is directly related to HCAHPS scores. The stress of the pandemic is catching up with nurses. Overfilling of hospitals, mandatory OT, and nurse burnout are causing an increase in staffing shortage. In 2021, Andrews reported that 33% of nurses leave the profession within 2 years due to poor work environment, workload, culture, and emotional strain. Also in 2021, American Nurses Association urged the U.S. Department of Health and Sciences to declare nurse staffing shortage as a national crisis. Nurse residencies and preceptorship programs trains nurses, but they are not fully integrated in the unit. They still feel like an outsider after training. They are scared to ask questions and are hesitant with their care. According to Peng and Ruers in 2021, nurse burnout and nurses leaving for travel assignments made 2020 as having the all-time high for nurse turnover rate. It is imperative that hospitals integrate new nurses in their unit or they will leave. A study by Perry in 2018 showed a direct correlation between high nursing turnover rate and low patient satisfaction score. Research question: is a mentorship program for TRNs effective in improving the nurses' job satisfaction and HCAHPS scores in a hospital setting, as opposed to TRNs who did not go through a mentorship program? Why should we implement a nurse mentorship program? Because it creates a nurturing environment for nurses. It helps improve their job satisfaction and confidence. It ensures new staff are properly trained and integrated in the unit. Nurses pleased with their job are highly likely to stay, thus improving the hospital's retention rate. Nurses who feel inadequate are more likely to leave compared to their counterpart. A study by Koster in 2017 showed adequate nurse staffing can reduce the risk of patient mortality. Hukmani study in 2021 showed an improved patient satisfaction by improving nursing satisfaction through a mentorship program. What is the significance of the project? Ortiz in 2016 noted a direct correlation between the nurse's confidence level and patient outcome. It is a vulnerable time for TRNs as they make the most clinical mistakes and medical errors during this transition period. Nurses satisfied with their job exudes a sense of motivation that patients can see. As a result, patients feel safer, have a higher satisfaction, and better outcomes. Definition of terms: transitioning registered nurses, TRNs. They are new graduate nurse or in-house experienced nurse transferring to a higher acuity unit. Mentees are the TRNs. Mentor are experienced nurses serving as a coach or advisor to the TRNs. Project lead is the DNP student. Critical care is intensive care unit or emergency department. I have 7 related studies to mentorship programs. The first one is by Hukmani and his cohorts. In 2021, published in BMC Nursing. Hukmani wanted to improve the hospital's patient satisfaction. They focused on improving nurse satisfaction through implementation of a nurse mentorship program. They found that the patient satisfaction improved with the improvement of nurse satisfaction. The next study is by Zhang and his cohort in 2019, published in Nurse Education in Practice. The mentorship program in Zhang's research was for a year. It helped the mentor and mentee preserve a close bond. There was a difference in turnover rates between the traditional preceptorship and mentorship program. Zhang reported a more than 5% lower turnover rates with the mentorship program. The third study was done by Vergara in 2017, published in Nurse Leader. The mentorship program in Vergara's study showed an improvement in job satisfaction scores. Turnover rates also improved from 18% pre-mentorship to 14% post-mentorship. Next study is by Powers and his peers. Some hospitals are still lacking the structure to train their preceptors. This often results in preceptees having a poor experience, which can lead to lower intent to stay. Powers study showed new nurses with a good preceptor or mentor is crucial for their success. The fifth study is by Middleton in 2018, published in Nursing Times. According to Middleton, nurses are expected to lead change. However, they need the proper training and resources to achieve this outcome. She found that mentorship programs can help mold new nurses into future leaders. The next study is by Williams in 2018, published in Nursing Economics. Williams did a retrospective cross-sectional research study and compared about 3,500 nurses within 24 hospital systems to determine if the mentorship helped them transition to the new job. Results showed positive outcomes between mentoring in practice, professional development, and stress management. The last study is by Croft and Stewart in 2021, published in Nursing Administration Quarterly. Their organization addressed the turnover rate issue by improving nurse job satisfaction through implementation of a mentorship program. They assigned new employees a mentor, which differs from their preceptor. The preceptor teaches them the intricacies of patient care, while the mentor acts as a support to help integrate them to the unit. Staff completed the surveys 3 months after the program implementation. Results showed a higher job satisfaction rating. The theoretical framework for this project is Patricia Banner's From Novice to Expert. It is a frequently used framework for nurses at different stages of professional growth. It is a situational model meaning that when a new nurse are placed in a situation which one has little experience, they default to context-free rules and theory for guidance. Benner's 5 levels of clinical competence are novice, advanced beginner, competent, proficient, and expert. We will be focusing on the novice to advanced beginner stage for this DNP project. The DNP project will be using a quantitative quasi-experimental design. The Plan, Do, Study, Act, or PDSA method from the Agency for Healthcare Research and Quality is a way to test a change that is implemented. Going through the prescribed 4 steps guides the thinking process into breaking down the task into steps, evaluating the outcome, improving on it, and testing again. Plan. This is when the project lead plans the project with the leadership of the hospital in the unit. In Do, the project lead and the leadership of the hospital creates the mentorship program, recruits mentors, trains the mentors, partners mentors with the TRNs, and performs the pre-intervention survey. In Study, the post-intervention survey is collected and results are analyzed. For Act, the project lead discusses the results with leadership and decide if it is feasible to add a mentorship program into the current nurse training program or modify the study and do it again. What is a mentorship program? It is not an extension of the preceptor program. After the TRNs complete their training, they will be assigned a mentor. The mentor and TRNs will have a weekly meeting to summarize the TRN's experience. They will also address barriers, issues, and challenges to working independently. The survey tool for the project is the Conditions for Work Effectiveness. It was developed by Heather Lashinger in 1986. This tool assesses the workplace environment. According to Lashinger, the tool has been a valid and reliable tool over the past decade for nursing. The survey tool has 21 Likert-style responses, ranges from 1 to none to 5 a lot. The pre and post mentorship program survey and HCAP scores will be analyzed to determine how the data responded to the mentorship program. T-tests will be used to compare the pre and post mentorship program survey and HCAP scores. A paired samples t-test is used to compare the means of 2 samples when each observation in one sample can be paired with an observation in the other sample. Ethical considerations. There is no risk for patients. There's no direct patient data or information. The subjects are going to be the nurses in training. However, the project lead will still submit for IRB approval. How does the project add to the body of knowledge in nursing? Current onboarding process for nurses are the nurse residency and preceptorship programs. It works well in preparing nurses to care for patients, but they are not fully integrated in the unit. We want to know if nurse mentorship programs added into the standard training can improve a nurse's job satisfaction, which is directly related to improved HCAP scores. References.